Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
This is Phil Ferris, and welcome to the show. Today's guest is a real trendsetter in the healthcare arena. Dr. Mike Carberry is a chiropractor, a national speaker, founder and president of Advanced Medical Integration. Advanced Medical Integration, AMI, is the nation's leading consulting group for establishing holistic, philosophically based medical integration. Whether you're new to medical integration or already have an integrated center, AMI will help develop your practice to the new standard in desired holistic medical services. Thank you, Mike, for being on the show today.
Thanks, Phil. Glad to be here.
Great. Now, the changes in today's healthcare landscape has doctors, healthcare providers, and patients all really concerned. Yet you've created a healthcare model that leverages those changes so that patients get better care and healthcare practices can thrive. Can you describe what those changes are and how the AMI model leverages them?
Sure, I'd love to do that. So our model that we came upon has been developed over the last 20-some years. My wife and I are from different disciplines. I am a chiropractor, and she is a physical therapist, the arch enemy of chiropractors. And we joke when we say that. We don't think that our professions should be at odds with each other. We believe that our professions, like all allied health professionals, should work together and try to come out with the best outcomes for our patients. So our focus with our patients is to be more drilled into getting the patient well, believe it or not, than to make a profit. And, in the business world, people say, well, is that a legitimate way to do things? Well, if you look at some of the leaders in industry over the last 100 years, just about every one of them said, if you get in the business for making money, you should get back out of business. In fact, that was a quote by Ray Kroc, the founder of McDonald's. And the idea is if you're in a business, you should be really good at what your business does, and you're trying to satisfy a need and a want for your society in your area and as far as your business can reach. Well, we've taken on American healthcare, and what we've said is we need to improve healthcare, and chiropractic alone can't do it, physical therapy alone can't do it, and medicine alone hasn't been able to do it. So our idea was to combine all of the professions together and trying to address one of the most common health problems that people have. So when we work together, it's, all minds together coming out with a better, the old adage, two heads are better than one. That's what we're trying to do. We got the concept actually from my wife's background as a physical therapist because she specialized when she first started her career as a head injury physical therapist. And that approach was, you can imagine 70% of your clients coming in or your patients coming in being in a coma. That's a pretty difficult case. And what they would do in the hospital she worked in is they would collaborate. There would be a physiatrist who would examine the patient and supervise the team. And the team was a physical therapist, an occupational therapist, a speech therapist, and a cognitive therapist, all working together for a better outcome to the patient. That's where the idea originally came from. And we copied that same model, trying to put this in. What we're approaching or what we're handling is arthritis and postural problems, which arthritis is listed as the number one most common chronic disease that human beings have. And it's, the number one reason to be in a hospital is to be born. And the number two reason to be in a hospital is spinal pain. When you look at that, it's the vast majority of the population will suffer with arthritic problems. So that's what we're trying to address.
Okay. And then your target population is the population is growing, which is the baby boomer, which is presenting a lot of different healthcare issues of how do we treat people, and if we get them healthy, it will cost us less to keep them healthy than it is to keep on treating them, and taking them in the hospital. So the thing that's intriguing to me about the model is that it's like everybody has to win in order for this to work. So I'd like to drill down a bit and try and understand how everyone does get better, benefit from this. So let's start out with how do the patients, how do they benefit from this, your model?
Well, if you look at healthcare in the United States and you look at statistics, And let's say you look at people like Dr. Barbara Starfield, who was a person from, she was a master's of public health and a medical doctor, and she was from Johns Hopkins. And she actually wrote an article in July of 2000 that was published in the Journal of the American Medical Association, looking at how healthy our healthcare system was. And when you look at those statistics, they're not very good. The United States, she looked at 13 countries, the richest countries in the world, and she compared them in about 200 different categories as to how healthy and how effective their healthcare system was. And as it turns out, the United States actually not only has the most expensive healthcare in the world, our healthcare, which is 4.4% of the world's population, is more expensive than the entire rest of the world combined. So there's something wrong with that. Then if you look at the statistics, when she ranked us, we came in 13 out of 13, last place. And she looked at things like the number 3 cause of death, according to Dr. Starfield, was the side effects of medical treatment. So if you look at those statistics, you go, why do we have the most expensive and apparently most ineffective healthcare in the world? Now, we don't have ineffective trauma care. If you were to get hit by a bus, you'd want to do it in the United States, because they can land a helicopter in that intersection, scoop you up, fly you to a trauma center, put you back together, and there are miracles that can be performed, and they do happen on a regular basis in this country. But when it comes to health care, I don't believe we take the right approach to health care. The main approach to health care in this country is to get people to not feel their symptoms. And what we're trying to do is to look at the idea, if you treat a symptom alone and you don't actually find the cause of it, the symptom's just going to keep coming back. And you're going to have to take stronger and stronger and stronger drugs. And that's why there's an opioid crisis in this country. I mean, the opioids that are prescribed in the United States, the volume of them are staggering. The number of people, there was just an article in the Atlanta Journal-Constitution on the front page, and they said they looked at the amount of opioid prescriptions written in the United States per 100 people, and it was 100 prescriptions. Now, that doesn't mean everybody got one, but there's enough written for everybody in the United States last year to have at least one opioid prescription. And there were states that were more than 100, like Alabama, which was 127 prescriptions per every 100 people. That's a little bit out of control because opioids do nothing to fix the patient. What they do is they actually just make the patient numb to their pain, but eventually the body says, well, I need something stronger now because I've overcome this numbness. There's a reason that the body's feeling symptoms. So what we focus on is we focus on function. We believe that if you address function, whatever the functional deficiency is in the patient, then the symptoms will go away and stay away and not require more and more medication. And that's why we get such bad grades in healthcare. So what we're trying to do is we're trying to shift healthcare away from a symptom-based model into a function-based model so you can actually improve the patients. I mean, arthritis, the most common degenerative problem we have is a functional-based problem. And it's if you address it, you can change the function of the patient, which means the symptom will definitely decrease and go away if you actually correct the functional deficit. So that's what our approach is. From these 3 disciplines, we're trying to improve function in the patients so that they require less or no pain medication to handle their symptoms. Does that make sense?
Yeah, that makes a lot of sense. But can you explain a little bit about how correcting a functional dysfunction, how that might apply? Can you give me an example of how someone with arthritis might be treated differently from the functional standpoint as opposed to this symptom standpoint?
Sure. An example, there's a lot of examples I could give you, but a very common one is spinal surgery. Without getting too complicated, we have discs between each level of our vertebrae. And the discs are soft but very tough cartilage-based pads that are a cushioning to allow us to be able to move. And it's, our spine is 90% of our weight-bearing joints in our body. So these discs, because they're soft, do not have a direct blood supply, because if we did, the blood vessel would be pinched off by the weight bearing of the disc. It's kind of like if you park your car in a garden hose, you can't water the garden. So what has to happen is to imbibe nutrients into that disc, each vertebrae has to move independently. So when you improve the movement of the vertebrae, now you can imbibe more nutrition, and a weakened disc, which could be bulging, can actually unbulge and restore its nutrition strength back to it so that it will not bulge anymore and function again. The only way to do that is through chiropractic and physical therapy, and there are medical treatments that you could do where you could actually do injections, maybe not using steroids, but following the tenets of Janet Travell, who was a medical doctor who treated John F. Kennedy, who said you can use fluid. By injecting fluid into arthritic areas, you can break scar tissue and adhesions, which is limiting the motion of that joint and allow the joint to re-imbibe nutrients again. So the example that I'm looking at is if you look at things like chiropractic physical therapy and these injections versus surgery, surgery creates more scar tissue. Now, I agree that there are times when people need to have surgery, but the effort should be, well, if you have to get surgery, there should be a lot of treatment afterwards to break up the adhesions, because nothing creates more scar tissue than surgery. And everybody knows, all the statistics point to in healthcare, that when somebody gets surgery, their degeneration will accelerate because we don't really address the limitation of motion from the scar tissue formation. And that's one of the things we would address. So in our clinics, we probably see 1 out of 3 of our patients already had failed back surgery. And failed back surgery, the national statistic, I believe right now is running around 75% failure rate. And it's because of the scar tissue. So that's an example of trying to go after the symptom at the expense of the function. Does that make sense?
Yeah, that does. And I guess it's letting the body heal itself, putting itself in a position to heal itself, because the body, that's what it's made to do.
That's a great question. And if the body has a herniated disc, that's a threat to the spinal cord. The spinal cord is probably the second most important structure in your body following the brain. The brain runs everything, and the way it communicates is through the spinal cord. When somebody has a herniated disc, the body's making a priority decision. What's more important, them being functional and out of pain, or me jeopardizing my nervous system? So what the body will do is try to heal it as quickly as possible by utilizing scar tissue. But we know that through the intervention of holistic type medical treatments, including chiropractic and physical therapy, you can actually limit and reverse the amount of scar tissue formation and stimulate that joint to heal better without future complication. So, the body will heal, but sometimes just healing by itself, it's saying, well, being in pain is better than being paralyzed. So what we would say is, well, let's help facilitate that healing to do it with less scar tissue and more natural tissue, so that this patient can have both, not being paralyzed and be out of pain.
All right. Well, now, Mike, I'd like to shift our focus a little bit to talk about how do chiropractors benefit from this business model that you have?
Well, chiropractic has been one of those professions that have been on the out fringes since their evolution in 1895. They've been around for 130 years, and they haven't really captured a good majority of the population when it's the most common ailment that people suffer with is what chiropractors treat. And there's a lot of different reasons for that. But what we find is that chiropractors have a tool using functional adjustments where we're trying to gently break adhesions to help increase the motion of the spine to prevent degenerative changes and in some cases even reverse it. So we have a great tool, but it's not really getting out to the public. And there's a lot of reasons for that. There was a lawsuit against the American Medical Association by the chiropractors, and it went from, I believe, 1974 to 1987, which is when the U.S. Federal Court of Appeals ruled that, indeed, the American Medical Association did conspire against chiropractic because it was a drugless profession and did not sell drugs. And not because it was dangerous, because it's not. It's actually considered one of the safest modalities around. And not because it didn't work. It was one of the most effective modalities around. But primarily, the court said because we were not prescribing drugs, and the AMA didn't like that. So what happened was, before that decision was made, chiropractors were on the outskirts and could not work with a medical doctor. But after that ruling, the court said you cannot limit the ability of a chiropractor to refer to or receive a referral from a medical doctor. You cannot punish a medical doctor for referring somebody to a chiropractor. So that changed things, and it was with less than 10 years after that that we started making this integrated practice. So the idea is chiropractors now bringing on other professionals can broaden the scope of the practice. The chiropractors, even though they might be the executive director of the clinic, and not all of our clients are chiropractors, we do have nurse practitioners that brought chiropractic into their practice. We have some medical doctors who brought chiropractic into their practice, and we even have podiatrists and acupuncturists who brought chiropractic and medical into their practice. So the idea is the owner, which most of them are chiropractors, broaden the scope, but they have to function as an executive director, not as a clinical director. The clinical director would be the senior license, and that would be the medical license. So we teach chiropractors how to set these venues up to where they can find medical people that agree with the philosophy that we've been talking about, and the chiropractor can set up the clinic as an integrated team. Now, what usually happens with our clients is first they have to find a medical person, and you'd be amazed how many medical people are actually embracing this model. We've had lots of doctors tell us over the years, finally, I can now get people well without writing a prescription, or I'm writing prescriptions to help people get off of prescriptions instead of just keeping them on them for the rest of their life. So in this model, the chiropractors can expand the scope of the practice, which means they can reach more people, help more people, do it compliantly, and make a bigger profit. And then the medical people can work in an environment where they're not rushing through. You know, a lot of family practitioners tell me they're rushing through their visits. They have to see 40 or 50 a day to make a profit because they're not really reimbursed very much. And the patient expects them to heal them on the first visit. And the easiest way they say to do that is to write a prescription. And there's a lot of doctors I've worked with over the years who said, I hated doing that. I didn't think it was the right thing to do, but that's what the standard of care is being taught. So this model gives them an ability to actually functionally improve the patient. We work on these patients for a period of time, similar to a physical therapy visit or care plan. We treat them, and we help to reverse these functional limitations so that at the end, the patient reaches maximum medical improvement. The medical people love that. The chiropractors that we work with love that. It also improves the ability to expand the business, which means more people employed and more profitability to the clinic, which means they can expand the model. We've had a lot of chiropractors join our program, and they realize our systems are so good that they've actually gone from one practice to 5 practices in less than 2 years because they realize, you know what, these systems work good. Once I get the first one ironed out, I can continue to open more of these clinics, and they do.
Having systems gives you leverage and scalability as opposed to trying to one-off everything, which is not. See, the trick in this model is you can't have a system that people just follow blindly. You have to have systems where people can actually think and create because every patient is different. Every patient has a different presentation, and that's what our systems are designed as. The clinician can look at the patient, utilizing our systems, and figure out which is the best way to go with this patient. What are the best things for me to work on? What are the things that are functionally limiting this patient that is affecting their activities of daily living so we can restore them and get that person back to enjoying and living life instead of suffering through life. Okay, but now integrating multiple disciplines and practices and personalities under one roof sounds like it can be, kind of complex and challenging. What are some of the biggest challenges that they face, that your clinics face, and how do you help them overcome them?
Well, that's a great question. We find that chiropractors and medical doctors and nurse practitioners and physical therapists don't all think the same. And one person from one profession could say something very logical that would be misinterpreted by the other professions. So it's this communication barrier, I would say, is the biggest barrier. So the way we overcome that is we do trainings. When somebody hires us, we have trainings all around the country. I just flew back from Clearwater, Florida, late Saturday night into Sunday morning. I live in Oregon, and we were in Clearwater at the Hyatt on the beach there, beautiful facility, and we were teaching medical people to work alongside chiropractors and physical therapists. So we had a room with physical therapists, nurse practitioners, medical doctors, and chiropractors all training side by side, learning how to work in this model and how we look at the model. And what's really cool about that is you see these different professions. It was a 2-day training, and they have these epiphanies along the way. Like, this is really good. I realize I can help people, and I don't have to just give them like an opioid or put them on a prescription to numb their pain. I can actually now figure out what is wrong with that person. So we like doing those trainings. We do them all over the country, and that's how we help. We also do 1-day trainings on how to logistically process a patient through the practice, and that training is only done at our clinic in Chattanooga, which is our training center. and doctors from the country, all over the country, fly in about 3 or 4 times a year and get trained on that. We have other trainings as well. We do that one-day training is actually done 12 times a year in that clinic, and our 2-day trainings are done 4 times a year in that clinic. So it's the training that actually bridges the gap. It's the hands-on and the communication and getting each other to realize we're all in the business. I'll tell you this, Phil. After doing this for 20 years, not all doctors, medical, chiropractic, physical therapy, are interested in helping patients, but the vast majority are. I would say over 80% of all of those professions got into healthcare for the primary purpose of wanting to help their fellow man. And that's who we look for to work with. This model is designed to get patients well, and we look to work with people that are genuinely interested in doing that. That's who we work with. And when you get that and you tell everybody, look, I know we all have different ideas of how we were trained in school. Let's put them aside and let's look at the logistics. One of the things I do is most of the research we use to teach our medical people come from medical doctors. You know, there's a lot of research out there by Dr. Rene Callier and Dr. Vladimir Yanda and a lot of different medical authorities, Dr. Janet Travell, where they actually were recognizing that we didn't have the best healthcare system, that we need to be more function-based and less symptom-based to get patients well. So that's the idea that we train from, and it's really exciting to see people have the epiphanies when we teach that. And I hear people a lot of times, a lot of medical people and a lot of chiropractors saying, this is the reason I got into healthcare. Thank you so much for helping me do that.
That's great. I was wondering, could you share an epiphany that may embody how people make this transition from, I guess I call it like the silo system in most businesses. When you have different disciplines, they can't see anything but their own until they get that epiphany. So what would be an example of one that you would experience or may have experienced during the training?
Well, I could give you a couple of them. One of the epiphanies would be from the viewpoint of the chiropractor, and that's the chiropractor having this epiphany. I've had some of them come up to me and tell me, you know, I realize that I have always functioned like a lone wolf, like I had to be the guy to fix everything, and I had to be the person who treated everybody. And in this model, I'm realizing that I could be more of an executive and help other people using their expertise and their knowledge, which is different from the chiropractors, to actually help people. And it's the chiropractor giving up some control to expand this facility to give patients more options and more ability to get well. That's from the viewpoint of the chiropractor. From the viewpoint of the medical person, I'll tell you a true one that a medical doctor shared with me one time. He said to me, you know, this is the reason I got involved in healthcare, was to help people. And he said, in family practice, which was his background, he said, we have to rush through the visits because we don't get paid a lot for a family practice. And there's a business side to running a practice. And what he told me was, he said, on the business side, I had to see more people than I felt comfortable with in one day to make a profit. Otherwise, I'd go out of business. So he said, the number is between 40 and 50 patients a day. And I have to do an exam on these people. He said most of them were existing patients that I hadn't seen for years that are coming in with a problem and saying, fix me, and they're giving me one visit to do it. They're expecting to go into that doctor, see the doctor, and have the doctor write a prescription that will fix them. Unfortunately, that's not what happens. The doctor comes in, he has to rush through the visit, and then he has to write a prescription, which is going to temporarily alleviate their symptoms, but most likely create more symptoms. And he said, I actually stopped. I became a little bit of a recluse and stopped going shopping with my wife because I was afraid I would run into a patient who I wouldn't recognize because I rushed through the visit, and I didn't want to run into that. And he said, now, in this model, there's people coming in with very real problems, facing surgery, and I work with them over the course of a number of visits, whether it's 4 to 8 to 12 weeks, whatever it takes to fix the patient, and I get to know them because they're coming in on a regular basis where I'm doing my re-exams, and I'm seeing these patients get well. And this is why I got involved in healthcare.
That makes a lot of sense. I know that talking to my doctor, he says, unfortunately, he said, I have to spend about 80% of my time during the visit on the computer working on the codes so that I can get the right, just so I can get reimbursed properly.
Exactly.
And so I said, I'm really not, getting the face time, the rapport that I need to really understand a lot of the underlying issues that are there and are present because I've got to, be on the computer. So that I can see where that can be a factor. Now, when a practice gets together, when they finally decide to start this business, what are some of the most challenging parts of just getting the business up and running, other than the communications? Are there other challenges that they're going to run into other than just the communication internally?
Yes, you have different licenses. The biggest challenge, especially if it's a chiropractor, they're bringing on people who have a higher license than they have, which means they have to turn over the control right away. And then there's also the facility. The ideal facility to handle something like this is between 2,000 and 3,000 square feet. And a lot of people come to us with that much space, but there's a lot of people come to us. A lot of chiropractors have smaller practices. And the smallest one we ever put a model like this into was 1,100 square feet. And they ran that way for a year. And that was in the Chicago area. And what happened was at the end of the year, the clinic was doing well enough that they could expand into a larger facility. I believe they went to a 2,500 or 2,600 square foot office, which gave them the room they needed to perform that. If there's a rehab facilities, it's like a mini gym. You can imagine a physical therapy department takes up some space. So they have to put the space involved. You have to be compliant because you become a medical office, and there are different medical standards. For example, in Tennessee, I had to be inspected by Blue Cross Blue Shield to make sure that we met the standards of a medical practice according to Blue Cross Blue Shield standards. But that wasn't hard to do. It's just another step. So we help guide clients through these difficulties that they run into. And it's really not that hard. The biggest obstacle, I believe, is dealing with the unknown. They're now working in a realm they haven't worked in before, and they're bringing in people that they've never worked with before or interviewed before. Some of the doctors, some of the chiropractors are afraid to interview the medical people because they're like, I've never worked with medical people. And then when they do it, they find out the medical people were afraid to interview them because they've never been interviewed by a chiropractor. So it's interesting, but none of the barriers are so insurmountable. It's just a matter of walking people through the unknown. That's what we do. We've been doing it for a long time, several decades or 2 decades, and we've done it in different states for our own clinics. So we've encountered the different obstacles you can run into. All of them are overcomeable. So that's what we do, is we help our clients overcome those obstacles and help them to realize it's just different. It's change. And the biggest barrier is that you got to, people resist change because they don't like change. But once you overcome that, it's not that hard.
Okay. And it sounds like your program kind of works with them side by side until they do get up and running and get through that transition.
Yeah, we started with a 2-year contract, and we work with our clients over the course of 2 years. We have a training checklist. We employ coaches that are trained in my facilities. To be a coach, you have to have worked in my facility at various posts to understand how these systems work. And then my wife, who's brilliant, she's a physical therapist, but she's also a brilliant administrator, created a training system. So our coaches are following a 585-point training checklist that they go down to make sure all these things are put in place correctly over the course of the 2 years. And usually what happens is most of our clients finish before the 2 years and they have the facility up and running. And then what they'll do is at the end of 2 years, we say, well, look, if you'd like to stay connected, we have options to extend that contract. But we keep our clients all connected as a group. If somebody becomes a client of ours, we have 2 conventions a year, one on the East Coast of the country, one on the West Coast. And they're really exciting conventions. We have medical people to come. We had 2 surgeons speak at our last convention in October, and we had some podiatrists speak in our conventions. And so we tell our clients, when you join, whether you continue your contract after 2 years or not, you can come to the conventions for the rest of your career, because we want to keep everybody connected. We're trying to create a group that is trying to promote this idea of getting people well more naturally and less from a symptom-based, but more of a functional-based outcome. So we want to keep our group connected. So that's how we do it.
If a chiropractor or a medical person or a physical therapist was interested, what advice would you give them? If they're kind of on the fence, should I or shouldn't I expand, go outside my comfort zone? What advice would you give them that might help them make that decision, that this was the right decision for them?
Well, first, certainly I would tell them to make sure that it's the right decision for them, and there's ways they can do that. I do Discovery Days, which is how we talk about our company and how we work in great detail. I just did one on Saturday in Clearwater to a group of doctors who was considering that. There was 2 medical doctors in a group, and there was about 5 or no, it was probably more like 10 chiropractors in the group. But they were there to learn and see if this is the way they wanted to go. And we do these Discovery Days all around the country. I do at least one a month. Sometimes we'll do it in one of our clients' offices so that people can come in and see what the office looks like. And sometimes we'll do them at a conference room in a hotel like we did at the Hyatt in Clearwater this weekend. But my advice to them is make sure this is something you want to do, because change is not easy. And you're going to be pulling your hair out when you go through change, but it's just like doing anything for the first time. It's scary the first time. Once you do it, then it becomes easier. So my advice is to make sure this is the way you want to go, and go to one of those Discovery Days, or at least go on our website, which is amidoctors.com, amidoctors.com, and that you can find out, is it the right way to go? If you want to find out how our schedule is and when our schedule is, you could send an email to either support@amidoctors.com, or I can give a phone number if that's okay.
Absolutely.
Okay, our phone number at AMI, Advanced Medical Integration, is 888-777-0815. And that's the best way for people to find out, is this the way I want to go, or is this not for me?
And I guess it's like trying on a suit to see if it fits, and you're providing lots of different options for them to make sure they do that.
Exactly.
It is a big, kind of commitment to make that change, but the payoff is going to be there, and they're going to be able to see exactly what their practice might look like by these Discovery Days and your training. So that's outstanding.
That's exactly.
Go ahead.
I was going to say that's exactly what we're trying to do. We want people to know it's the right thing for them and for their practice before they do it.
And I guess, like you mentioned, it really is for the person that wants to provide better outcomes for their patients and have the time and the disciplines around them to be able to do that. So that's a very exciting opportunity for those that want to do that. And I want to thank you so much for being on the show today.
Thank you for having me, Phil. It was a pleasure to be here. And, hopefully I'll talk to you again.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.